Good afternoon. We still need more staff in our health system. We're working on new bonus plan for the people who will come work full-time. Today we're announcing gradual measures to soften the rules for our elderly. We know the situation is very difficult. Autonomous people have been isolated for 2 months now. We've imposed this for public health reasons. It's time to let them return to a more normal life. Of course, the virus is still there and we must stay very careful. Everybody will have to follow the rules and continue our distancing efforts. I'm counting on you all. Thank you.
Good day. For Mr. Arruda, we're just looking at some numbers in Montreal again. We now have 6 boroughs with more than 1,000 cases in the Montreal area. Can you tell us? Can you update us on what is happening with with the number of deaths and the number of cases that are still going up?
You want to know exactly the number of deaths in Montreal?
Yes, and do you have an explanation for why this is continuing?
Okay. I just want to give you the number of deaths exactly in Montreal for the last 78. 78 yesterday. In fact, it's related, and it's really related to, I would say, what is going on in CHSLDs. In Montreal, the outbreaks have been driven from what we think actually. First one have been driven in the first part from through travels coming back, especially from New York, with some outbreaks that happened in certain communities. Afterward, there was, I would say, the CHSLD's issue with probably workers, health workers who were working in different CHSLDs that probably introduce or get the disease from one center and spread it through, I would say, certain CHSLDs in Montreal. And that is explaining, based also with the fact that now we know that people can be contagious 6 days before getting the symptoms. That makes, I would say, a perfect situation where there is elderly people, very sick, especially the ones over 80 years old, 70 years old, people, and with, I would say, the problem with staffing in CHSLDs that promoted, I would say, infections that were expanded in those settings. We are now analyzing is there a lot of transmission in the community in Montreal? I think there is perhaps some, I would say, but in relation with those outbreaks and with those trips that have been from New York, especially in Montreal from New York.
And second question for Mr. Legault. There seems to be confusion with what's happening in the high school academic year. I don't know if you're able to answer this, Premier, but I'll try. Can you clarify, do students have to do the work that is put on the École Ouverte website, and will they be marked on this work?
Okay. First, starting next week, all services will be given for children of teachers, so they will have all the time to get more in contact and do some work with the students that are at home. And we expect also that the students ending their high school, that they'll be able to go to the college. So for the people coming back to high school, we may have a part of the work that will be done in September, but for the one ending their high school, we want them to have the opportunity to go to college.
Thank you. Cathy Sonnet, CBC News.
Good afternoon. There was confusion when the measure about caregivers was announced mid-April. What forced you today to change the rules? Was the confusion or the fact that you heard so many stories about elderlies dying alone in Quebec?
Yes, you're right about this. You see, we put in the balance what was the best for the people, for the population, and the best right now. It's to give the right to the caregivers, the significant caregiver, to be able to visit the person who is living in a CHSLD or RE or RPA or whatsoever, you know, les milieux de vie, and to be able to be there, because there are some people who are dying without seeing their lovely, and this is unhuman. So that's why we are in the week of santé mentale. So I think it's about time that we take care also of the caregivers and the people who are living in this milieu de vie. I don't know if Dr. Arruda wants to say something else, or the Prime Minister.
What I would say is that on April 14, what we announced is that people responsible for residences, if they thought that it would be good to have some caregivers coming and helping them, that they can do so. Today, what we announce is very different. We say all caregivers, they have the right to see their people in those homes. And if residence management refuse, they will have to justify why. So we're really changing. We say now you have the right to see your people. All caregiver must be welcome, and if they are not, we want to know why. So it's different. At the time, it was more a question of coming to help residences who wanted to have this help.
But some were refused, so we knew
that. Yeah, we
to
saw that many thought that it would be more trouble than helping them to have those caregivers coming.
And in fact, we wanted the same thing, but the observation was making that doing it that way, it doesn't work. And I just want to also say that, you know, there is kids we are actually on DPG or on different families who haven't seen their parents too. We want to make sure that you understand that the kids could and the parents could get access to their kids to visit them also. I think Dr. Karma is very wants to make sure that the kids and the ones who are have deficience intellectuelle or autism or other kinds of troubles can be in touch with their family. So I just want to make sure that people understand that when we talk about RPA and RTF, that includes also the youngs that wants to see their parents and to keep a contact with their family, even if they are in a house elsewhere.
And for seniors in private residences, you're evaluating the risk, the dangers of COVID-19 versus the risk of feeling and suffering from solitude and sadness. There are concerns that perhaps that goes too far. You'll see. But do you fear any backlash if you have to go back, or what it was for almost 2 months for them?
You know, we are observing the impacts on physical, mental health, stress, anxiety on elderly persons. That's the case for even our young adults and kids and teenagers. Everybody is upset with being confined. You cannot confine everybody for a long time. There is studies made about the brain changing. There is data which is not only the infection but also the impacts. The balance, actually. First of all, people understand that COVID is a serious thing. I think that in March and April or before, people were not aware. We had not those people dying everywhere. So I think the people are intelligent. I believe people are intelligent. People will respect the way of doing business. So I think based on the balancing of mental impacts, we had people who even stop to eat. They want to die. They don't want to be in that situation. There is some suicides that could happen. So I think this is worse, I think, than letting people go a little bit outside. And we cannot be confined for... Everybody's going to get crazy if we keep that for months. And elderly people will lose their autonomy, especially the ones who are autonomous, actually, because they are not stimulated.
Thank you. Samuel Pouliot, CTV News.
You said it a bit in French, but are these new rules also going to be applied for elders who are over 70 and who live on their own in their own homes? Will they be able to go shop and go outside?
Yes, the rights of all the people will be the same independently where they live, unless there is an outbreak. If you are sick and you have COVID-19, you're not supposed to go outside. But if you're in good health, you can go as others will go.
Okay, and on another subject, your order to limit the distribution of Ventolin, the popular asthma inhaler, is worrying some patients. Is there a risk that comes with changing medication in the middle of a respiratory pandemic?
I'm sorry, it's not really my the thing is that we change the Ventolin.
Yes, there's a distribution limit. Like
okay. Well, look, I could perhaps try to have the answer of the question for tomorrow, consulting my people. But I think it's probably because of supply issues that they will prefer to make sure it's going to be used. It's a medication that is a lot used. Probably you are keeping him for the people at more risks, and probably it's why there is because of the supply. A certain caution, but as soon as it come back normally, I think the normal situation will come back. But I can make verification and even send you a mail if you want to have the information.
Thank you. So 2 last questions sent by Raquel Fletcher, Global News. The World Health Organization is urging countries to check their records for any suspicious early cases after reports that France had a case of COVID-19 in December, nearly a month before the country confirmed its first case. Is Quebec investigating or planning to investigate suspicious early cases?
Yes, we will. And also one thing that we're going to do is we're going to look retrospectively, and I think it's a good thing to look at what was the levels of people dying in December, January. We're going to compare the excess of deaths that comparing to other years before, and sometimes those excess deaths are an indicator of people. And I would say also that it's going to be a way to best compare one country to another one, because based on surveillance systems could be different, or the testing capacity could be different. When we're going to look back at the death rate in exactly from one period to another one, we're going to see if there was excesses that have not been taken into account by our systems.
So one very last question from Raquel. Why have statistics concerning infection and death in long-term care been taken down? Is there a dispute over the accuracy?
No, it's because right now we're checking the cases that are still active, because we put the number of confirmed cases, but we know very well that either some are dead or some don't have the COVID-19 anymore. So we're cleaning the data, and as soon as we'll have it, we'll give it to the public.
So thanks for all your answers. Merci, c'est ce qui complète pour cette conférence de presse. À bientôt. Bonne fin de journée.